Patients often think that they have to know that they're going to do laser eye surgery and what laser eye surgery they're going to do before they even call us. They ought to be calling before they make any decision to have laser eye surgery. They will get extensive testing and analysis, and then based on our protocols and our understanding of how things work, we're going to offer the best possible procedure. As far as I'm concerned, laser eye surgery can only be done one way, and that is at the highest possible level of safety with the highest possible chance of achieving a perfect outcome.
One of the big advantages we have here in our clinic is the Artemis technology. The Artemis is a high-frequency ultrasound scanner which is able to not only map the surface layers of the cornea, which is what most of our technology can do, but it's able to look at the individual layers of the cornea. It enables us to treat much higher prescriptions, and also what it does is allows us to treat more people who may well have been turned away using just the conventional technology that's out there.
An ultraviolet laser has been the mainstay, a laser which removes just tiny quantities of tissue from the cornea. And these very fine sculpting procedures change the curvature of the cornea and therefore changes the power of the cornea and the focusing power of the eye.
What we prefer to use in our clinic is a system developed by Professor Dan Reinstein. It's called Laser Blended Vision, or PresBeyond, and it's designed to boost reading and distance vision for any prescription, and most importantly, we don't degrade the optics of the eye, so we maintain things like night vision and contrast, which a lot of these other modalities really struggle to do. The treatment is done at the pace that the patient is comfortable with. Some are done in 10 minutes, some will take 14 minutes. The average is around about 12 minutes, and that's of course treating both eyes. It's important always to remember though that the laser is only used for 20 seconds at a time. Most of the treatment is spent positioning, checking, double checking, making sure everybody's comfy as we move along.
What makes London Vision Clinic so special is our customer service is really a cut above the rest. We really embrace each and every patient as an individual, and we like to see them all the way through the journey.
The bond that we create with the patient is very important. It's really important that they feel comfortable with us and that they trust us. A lot of patients find it nerve-wracking being around medical personnel, so it's also important that even though we come across professional, we try to make it quite informal.
What everybody always says is waking up in the morning being able to see is the most amazing experience ever.
It will just mean that I don't have to wear my glasses, I don't have to put my lenses in, I don't have to think about taking my lenses out when I go swimming. It made me feel quite vulnerable before when I couldn't see everything around me. So that will now have gone away and I won't have to worry about any of those things.
I want everyone to be free of this disability of not being able to see without visual correction. It's safe, it's highly effective, it doesn't hurt, it heals in a few hours. It's modern medicine used to enhance one's functionality and one's quality of life.